I will now share the most current case counts. There are 69,981 confirmed cases of COVID-19 in Canada and 20,546 cases in Ontario. Chatham-Kent has 90 cases and Sarnia-Lambton has reported 203 cases. Michigan now has 47,552 cases, with 9,851 cases being in Detroit. Today, we are reporting 732 cases of COVID-19 in our community, an increase of 6 cases from yesterday. 39% of our cases have occurred in long-term care homes, including both residents and staff. 287 cases have resolved. 17% of our cases are between the ages of 20 and 29 years. 15% of our cases are between the ages of 50 and 59 years, and 20% of our cases are 80 years and older. 42% are male and 57% are female, and 1% is unknown at this time. Our community has lost a total of 61 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 15 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit eHealthWindsor-Essex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for joining us. We are deeply saddened to report 2 additional deaths today. One woman in her 90s and another one in her 80s passed away yesterday. Both women were residents of long-term care homes. I would like to share my condolences with the family for their incredible loss. This morning, I'm also pleased to be joined today by Elaine Isaacs, Integrated Care Manager at Southwest Ontario Aboriginal Health Access Centre, Windsor-Essex, or SOHAC. The Ontario Public Health Standards outline the importance of relationship between local public health units, boards of health, and First Nation, Métis, and Inuit people to ensure the appropriate delivery of health services, increase health equity, and reduce the disparities experienced by First Nation. The Windsor-Essex County Health Unit is excited to build upon our existing partnership with SOHAC and announce the expansion of COVID-19 assessment and testing centers for First Nation, Métis, and Inuit people and their families in collaboration with SOHAC.
Thank you, Dr. Ahmed. Sagoli, bonjour, kulamatse, wache. Greetings, everyone. During this pandemic and always, Aboriginal Health Access Centers like SOHAC work to ensure that First Nations, Métis, and Inuit people can access the services they need for good health. We are honored to have a strong partnership with Windsor-Essex County Health Unit that allows us to both improve health equity and provide culturally safe COVID-19 testing options for the Indigenous communities in Windsor-Essex County. Across SOHAC sites, we have been working closely with Indigenous communities and health system partners, local public health units, regional pandemic planning tables, and the local health integrated networks. We are inviting input and collaboration with First Nations communities in support of individualized responses for each community. For example, at our Chippewa site, we have been working closely with Chippewa the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation Health Centers, and are currently developing a partnership with Oneida EMS to explore possibilities for mobile testing for people with mobility issues. In Aamjiwnaang First Nation, near Sarnia, we are supporting the community response by providing a nurse to provide testing. They are also launching their testing today in partnership with Lambton Public Health. Here in Windsor, we are expanding our testing services beyond our existing clients to the Indigenous community at large, in alignment with our core mandate, which is to improve Indigenous health by increasing the accessibility and quality of health care services for individuals, families, and communities. We want First Nations, Métis, and Inuit people to know they have options when it comes to access testing. You do not need to be a client of SOHAC to be tested here. Services are open to all First Nations, Métis, and Inuit people living in and around Windsor. Screening is done over the phone with one of our healthcare providers. The first step is to call SOHAC Monday to Friday, 8:30 to 4:30. We will ask you about your symptoms, gather health information, and use a standard assessment tool from the Ministry of Health. And based on the screening, a testing appointment, time, and date are provided. When you come for testing, you'll also be provided with valuable educational information offered by our primary health care team. They will be there to answer any questions you may have and support you through the testing. We will provide you with instructions how to obtain your results. The Windsor-Essex County Health Unit will follow up on any positive results and ensure that you have the support you need. This information is posted to our Facebook page and our website. If you have any questions, please call us. We are here for you. Nyamago, Miigwech, Anukshuk. Thank you for this collaboration and for recognizing our Indigenous rights to determination our health. Thank you. Nyamago.
Yes, this is for Elaine. How many individuals does your organization typically serve?
Right now, we're currently serving close to 700 individuals, and we are expanding.
And then you're talking about opening these services up to the Indigenous community at large. How many people would that be that you would be offering to provide these services to?
Well, the recent Census Canada report shows we have a little over 8,000 in Windsor-Essex County. However, we are aware that not all Indigenous people complete the Canada Census, so we know that those numbers are much larger.
And can you talk a little bit more just about why it's very important to offer this service specifically to the Indigenous community and reach out to them directly?
It's really important that we broaden our strategies to address the health equities for Indigenous people. We want them to feel safe, comforted, and know that we provide the best quality care and understand where they come from as Indigenous people and the disparities they may have faced in the past.
Thank you.
Any questions from Blackburn?
Yes, sorry, a little bit unrelated to what we were talking about. Dr. Ahmed, there are reports from Chatham-Kent that 70 contact workers from Leamington that worked at Green Hill Produce, they were contact workers, and they were tested because of the outbreak there, and there were 12 that tested positive. That would be among our numbers. Is that a correct figure?
Numbers of anyone who is living in our region will be counted as a case in our community. So the cases that whoever lives here, it would have been counted already, and we continue to look for to add those cases whenever we identify a worker in these farms. If they're testing positive, we are reporting it and counting them in our list.
And so can you confirm how many migrant workers have tested positive?
I don't have an accurate number, but it would be somewhere close to between 20 and 25 people who have been tested positive so far.
And can some of those be linked to the outbreak in Chatham-Kent?
Sorry, can you repeat that question again? I'm having a hard time in understanding.
Can some of those, the 20 to 25, be linked to the outbreak in Chatham-Kent?
Well, the numbers, yes, if they are working in Chatham-Kent in the farm, they will be part of that. I don't have that number right in front of me, but as I said, anyone who is tested positive in our region, it would have been part of that number.
And do you know of any other outbreaks locally in any of the facilities?
So we have cases in these migrant farms. We haven't got to the point of declaring it an outbreak yet because those are isolated cases. These are contracted out in the community, and we continue to work with them. We have 176 farms in our region, and we have more than 8 to 10,000 people working in these farms. So compared to that, I think we are working with all these farms to ensure that it doesn't get to the point of expanding it or spreading it to a larger group to be declared as an outbreak at this point.
But if they tested positive, they would have been just like anybody else told to isolate, and you're working with the migrant farmers to make sure they're able to do that?
Yes, so all the individuals who are tested positive, the farms are providing them with individual accommodation at hotel or any of their residential facilities that they operate. So they are all self-isolating, and our team is in contact with all the positive cases to ensure that they are not getting worse and they do not require any additional support.
Thank you.
Any questions from CTV?
Yeah, I'm just curious, how vital is testing moving forward as we try to move into some sort of normalcy?
So if I'm hearing you correctly, you're asking how sustainable this whole lab testing piece. Well, I think again, depending on what questions are we trying to answer. So initially, our public health goal was to containment. So anyone who is testing positive, the goal is to contain them to make sure that they are not spreading it to the community. So that goal still persists. But now what we are doing is we are expanding that to even identify individuals, especially in the high-risk areas such as long-term care home and retirement home, and to get a better handle of what's happening there right now. And then that would give us a little bit better direction if we need to do more proactive work in that facility. Swabbing people or testing people, we just have to be careful. This is just a point-in-time assessment. It's not one thing that would prevent any of these cases from happening in the first place. So let's just be very clear, because some people think that if we are testing more people, that would help us to prevent cases. No, it won't. The only thing that would help us more and more is to follow the public health guidance, to follow the infection prevention and control measures that are being practiced, and individuals who are getting sick, they are staying home and they are following all that. So now the next question would be, as we move forward in the next stage of this COVID response, is how prevalent it is in our community. And then that means we'll have to expand the testing to even people who may not be symptomatic at all. Like I urge anyone who is symptomatic to go to the assessment center and get tested. So that's absolutely one thing that I want people to do. But some people are reluctant to go to the assessment center for various reasons. But I think people should go because we need that number. And then when we're expanding it, we need to have a better handle on what's happening in the community with these testing. And we also need to know when we start antibody testing, also what criteria that we need to use to have a better handle on what's happening in the community. So whatever we are having right now is the incident rate. So that means the new cases that are in the community. But then when we are going through the more lab system or testing more, we'll be moving more towards what's the prevalence in the community, and then what does it mean for our community in terms of the immunity that people are developing or not. So I think It is a good question, but those are the conversations that we are having right now. We haven't landed on a plan yet, and some of this will be guided by the provincial government. But locally, we are also moving into that model, that how we can get to the stage of having a better handle on what's happening on the ground.
So no time frame right now, basically,
Yes.
right? Okay,
Yeah.
So I guess next question, it was thrown at me by someone in LTC. Yesterday we talked about how all the homes by the end of the week probably will have been swept, right?
Yeah.
Or swabbed. So I guess the next question is, will there be a second wave of testing for the LTCs and the retirement homes?
So right now there is no direction on that, and some of the homes are already testing people, even though after we have the mass testing done. If someone who has been negative, let's say, but if they develop symptoms, they are being tested again. So I don't anticipate that it would be like a mass testing on everyone again, but definitely anyone who is developing symptoms, they will continue to be swabbed and tested, just like we normally do with any type of outbreak measures. Every time someone is symptomatic, the recommendation is to isolate them, to make sure that all the infection prevention and control measures are in place, the individual is tested appropriately, and when we get the lab results back, and then further measures are taken.
One more? Sure. Okay. I know we've talked about this in the past, but it's coming up again, so sorry about that. Just, would it serve our community to have a lab?
Absolutely, and I think that's it's getting more and more apparent that having a lab in a community of ours like ours, it would be really important for us. Right now, the majority of the challenges that we are having is around the logistics of how do we test them, how do we send it to the lab, and what's the turnaround time, and it is a lot. And depending again what the future looks like, if the current volume of testing, what we are doing right now, will continue, or even building capacity for the future, I think it is important that we should have a lab in our community.
Any questions from AM 800?
Yeah, the Aboriginal community could go to the COVID assessment center at the hospital to get tested. So why would this step be necessary for the Aboriginal community? If somebody can just explain to me the comfort level with this versus going to the hospital to get tested.
Sure, I'll answer to that.
Yeah.
So during this pandemic, and always, we want to ensure our Indigenous people have options. They need to feel safe and comfortable as possible to access the services they need. Aboriginal Health Access Centres recognize our Indigenous rights to determinations in health, and we support COVID-19 screening and testing services as identified and led by Indigenous communities and organizations across Ontario. We do this because we recognize the need for Indigenous-specific responses as part of a broader strategy to address health equity for our people.
And if I can add a little bit more to that, definitely the health equity piece is a very important piece, and we recognize that the Indigenous community is identified by the ministry as a priority population for testing. So we want to make sure that there are options available for the community to get tested and assessed anywhere. So they can, as you said, they can go to the assessment center, but now they also have the option to go to SOHAC for testing. So it's just increasing their options depending on their comfort level, and we don't want to put any barriers. In fact, we want to remove all barriers for people to access the testing and to get the support that they need in the way that they want it.
Dr. Ahmed, you mentioned that it would be beneficial for us to have a lab. If one was approved tomorrow for Windsor-Essex, what do you think the timeline would be for that type of thing, from construction to being up and running?
I probably am not the right person to answer that question. I anticipate it could be anywhere between 4 to 6 months, but again, depending on what are the current existing infrastructures that are available. Are we building everything from scratch, or do we have a facility that can be retrofit to create that lab? I honestly don't know, and may not be the right person to answer this question.
Okay, thanks.
if I can get a comment from Dr. Ahmed, there's a survey out that's saying the majority of Canadians feel uncomfortable going out in public. Do you have anything to say to that?
Well, I think COVID-19 has changed a lot of things in our day-to-day life, and there's a lot of anxiety and fear in many people, and we can see the opposite, that there are other people who don't think that this is a concern. So we see people on both sides, and it is significant enough that the government, not only Canadian government, but also government across the world, has taken these bold steps to practically shut down the whole country. So it is pretty significant. And if you're looking at people who are losing their loved ones to COVID, it is a concern for them. So I think moving forward, people will have to make adjustments, and they have to accept some of the realities of the new world, that how they have to do the physical distancing, how they have to continue to do the just practice respiratory etiquette, hand washing, new ways of doing work. So I won't blame people if they're anxious and concerned, but those are the things that everyone is experiencing, and we will just continue to learn from our experience and get better.